Good evening. This is a meeting of the North Andover Board of Health, Thursday, November the 3rd, 2022. It's about 7 o'clock. I'm Joe McCarthy, Board Chairman, and other board members in attendance are, to my right, Dr. Patrick Scanlon. He's the town physician. To my left, Michelle Davis. She is the board clerk. To her left, Jennifer Alboese. And to her left, Jennifer Libaudet. Wow, I finally pronounced the names right. And department members have Director Brian LaGrasse and a town nurse, Callan Lamb. So the meeting is called to order. We do have a quorum, obviously, and the first order of business is the Pledge of Allegiance. Pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Approval of meeting minutes from September the 22nd.
I have reviewed and edited the minutes from September 22nd, 2022, and make a motion to approve them as is.
Is there a second?
A second.
All in favor, say aye.
Aye.
Motion passed. Public hearing, Market Basket Tobacco Appeal. First, I'd like to hear from Ron Beauregard. He is the regional tobacco agent, and then we can turn it all over to the rep from Market Basket. So if you don't mind.
How are you? I'm not going to speak, please, I'm sorry, what's your first name? Tom. I'm going to be very brief, because Tom and I have had an opportunity to converse before the meeting started. When we did a compliance check on behalf of the North Andover Health Department, on that day, this would be September 16th, a Friday, at about 11:37 a.m. Our underage purchaser, 19-year-old, was able to purchase tobacco product. As is our protocol, after that occurred, it took me about 10 minutes or so to put together a correction order, and then I entered the store, and I had the great I can't say the great opportunity, but I always enjoy, I just mentioned this before the meeting, Meredith, I'm sorry, I don't remember if I have the wrong title, her supervisor there.
Correct.
Courtesy booth manager, supervisor. I think she has 31 years of experience, and I'd been there for an inspection a few months prior, I think back in March, a couple of times, to just make sure everything was in order there. They understood we had the ID all, but unfortunately someone did make the seal, and we issued the correction order. As you know, local law has been usurped by the state law, 105 CMR 665, which puts a substantially higher fine of $1,000. Not an easy thing to do. Never is, but we've been fortunate last fiscal year. We had a 95% compliance rate. That leaves 5%, which I guess in school you think of 95% as being an A. But when you're doing the job, and statistics are always funny in how you express them, if I told you instead of the way I just said it, that for every 20th store we go to, there's a sale. That doesn't sound as good. So we're trying to get that down much lower, try to get to that 1-2%, so I can say 1 out of 100 or something. Anyways, it's an error. It's not meant as an intentional act, but perhaps Tom can explain what happened on the other side of the counter.
Thank you. Name's Thomas Budden, Assistant Store Manager at Market Basket, North Andover. Fortunately, the store manager could not be here. He regrets that, but this is more of, the way I look at it is that we're a long-standing business that's been in the community a long time. We want to make sure that everybody in North Andover understands It was a mistake that happened. It's not looked upon lightly by us in the store or by the company as a whole. The employee that did make the sale of cigarettes, Diana Lorenzo, she was written up, given a warning. She was also suspended for the week. About a week prior to this sale, we have a form that every employee that sells cigarettes signs, stating they know the rules, which I have here. So she did sign that. It was dated September 9th, like I said, exactly a week prior. She had just out of there, been transferred over from the Lawrence store. So we are not saying that it didn't happen. It's obvious that it did happen. Once again, this is more just to let everybody know, the health department, the town itself, that it's not something taken lightly by us. Everybody that works in that courtesy booth, which is the only place we sell the cigarettes, have been retrained. And now it is a matter of every single person that walks in the door gets asked for an ID, whether they look like they're 20 or they look like they're 90, which has caused some issues with some people, some aggravation on some parts, especially the older crowd. But it is what it is, and we're just working to make sure this never happens again. So obviously, we'd like some leniency on the fine, but once again, this is more of just letting you guys know that it wasn't taken lightly, and it was immediately taken care of. And like I said, that employee was suspended, not terminated. Everybody does make mistakes. We do understand that, especially in our business, dealing with the younger employees, so.
So you're not here to appeal the fine, you're just here for
No,
further
we'd like some
clarification.
leniency on the fine maybe, but not, obviously, like I said, it's kind of like, there's no way of denying it happened, and that's not what we're here to deny or try and make it seem like somebody did something they shouldn't have to get us caught. The employee did it, we're not denying that, so.
I think it says a lot, just you coming here and, expressing that these corrective actions are done and how it doesn't represent you guys as a company. And, I mean, the employees and Market Basket itself kind of speaks for itself. So, but I just think it says a lot that you took the time to come to the board and just express what happened and made the corrective actions. That being said, number one, I don't believe we really, because it's a state fine, we don't really have lenience.
Ron on the leniency of the amount, but for now, I mean, they did make the sale.
I was
fine
just
is-
more
yeah.
inquiring, I'm
Yep.
not necessarily, I was just.
Definitely defer to Ron on the state law.
Want to speak from here? Is this okay?
Yeah, that's fine.
So when this law was enacted, came into effect in 2020, there was a lot of guidance that was required from local boards of health and health departments and from ourselves, working the tobacco control, to get the advice of partners, attorneys that work at the Mass Municipal Association, the Mass Association of Health Boards, and the Mass Association of Health Boards. I said that right.
MAHB,
I always
you
get those
said,
two
yeah.
mixed up.
MHOA.
Never try the alphabet soup. On the-
MHOA, MAHB,
MAHO, yeah.
MMA,
So.
Not the fighters.
They've all instructed us that this is a mandatory fine.
okay.
I never, no, how can I put this? As long as there are, and this is not to malign the legal profession whatsoever, but as long as there are attorneys to look at the law and try to interpret words and such, I'm sure both sides can come up with counter arguments as to whether or not there'd be any room for a compromise, so.
Tom, as Patrick, I too am impressed after listening to you, telling us what you're going to do, accepting responsibility, accepting the fine, and before you came to the podium, I was saying to myself, this is risky, because usually you want to keep below the radar, and you're above the radar here. But kudos to you.
Thank you very much.
And your company.
Thank you.
I think the retraining of all the employees right away says a lot. That's something that you guys, as a board, have mandated multiple times in the past, required mandated training through Ron's office for anybody that does do sales, and they've already done that themselves. So as the fine, I agree with keeping it as is, but that's my own opinion. We had other sales this round as well. Those have already been paid. It's unfortunate because it went up from $100 for a first offense to $1,000 to a first offense. That's quite a large jump up between 2020, prior to the new regs, and now with the new regulations in effect. But I'll leave it to the board to discuss and debate and ask any questions you may have.
I don't have any further comments on that. It is what it is.
Do we even have to have a motion, or is it just, it stands in place?
You could make a motion to maintain the order as drafted by Ron.
I'll make a motion to, even though I, again, appreciate
Nope, no
you coming
problem.
before the
Thank you.
board, I'm gonna make a motion to keep the fine as is.
Is there a second?
Second.
All in favor, say aye.
Aye.
Motion passed. Thank you.
Thank you all for your time, I appreciate it.
Thanks, Ron. Yeah, by all means.
I'll come up with you.
I think it's unfortunate that we had 3 sales this round, which is extremely high. I think with everything being a lot more low-key over the past few years because of the pandemic and places being closed, and them not doing compliance checks, now people get very lackadaisical in their practices, even though it is a state law to cart all. We call it the Fenway rule. No matter how old you are, when you go to Fenway, they ask you for your ID. So, 3 sales is, like I said, by far the most we've had in a long time. I hope that the latest round of fines has made its way through the tobacco sales community, and they all know that we are doing compliance checks again, and the fine is $1,000, and that we do issue them. So, the deterrence hopefully will keep that from happening again.
Were the other businesses as, I mean, I know they paid their fines, but were they remorseful in doing their appropriate,
They knew they made a mistake, and they knew they weren't going to appeal it and win. So they said, you know what, we'll learn from our mistakes, we'll pay the fine, and we won't do it again.
okay?
I hope that actually holds true. That would be a really good thing to have 0 sales next round. And the compliance checks have been reduced from 4, 15, 20 years ago, down to 1. So you get 1 check a year. If you fail that 1 check, that's not looking very good. So the goal is to get those compliance checks back up to 2 or 3 a year. That would be ideal, but I'm trying to work on that now.
So there's no recheck for somebody who does, they still stay in
Nope.
that same cycle?
Regional staffing makes it very difficult to make it to every single tobacco retailer across the Northeast, and all the communities that run has to deal with.
And the fine for the second offense?
I believe it's still $1,000, but I think, and I don't remember off the top of my head, I haven't read this statute in a while, but eventually there is suspensions, and I think, no, it does go up to 2,000, and then I think 5,000.
5,000's with
With
a
a third.
suspension, I believe.
Yeah. Yeah. So the fines do go up. I don't remember where they are off the top of my head, but I think it's 1, 2, and then 5.
New business, board elections.
How come we're having board elections?
I really haven't been looking forward to this, and so I want to digress for a moment.
Okay.
You'll like this.
All right, okay.
And go down Board of Health memory lane. Effective at the end of this meeting, I'm resigning as the chairman of our town Board of Health, but I'll remain on the board as a member until this opening is filled. I had spoken with our town manager, Melissa. I had spoken with the director of our Department of Health, Brian. I had spoken with all board members. I submitted my resignation, and it's tough. I've been on the board for over 15 years. But the prime resignation reasons are that I live part of the year now, as of the last few months, in San Francisco. Plus the fact although the pandemic is questionable whether it's over or not, but we're getting back to normal. And as such, as so many other people, even though I work part-time, I'll be working quite a bit going forward, catching up on what I fell behind on during the pandemic, quite a bit around the country and probably the world too. So it's certainly in the town's best interest and my best interest that I resign. I've been a member of the board. I really don't know how long, but it's been at least 15 years. I've been the chairman for almost the last 3 years. And I've tried, we have tried, excuse me, to keep our meetings brief, although I recently believe they're going to get briefer. Educational and informative. And our focus has been, over the last couple of years, the pandemic. I've also delegated as much work as possible to our very competent Department of Health. And what has been accomplished has been with the support and input of our Board of Health. Since I've been a board member, I ask a lot of questions. More often than not, I do know the answers, but I like to ask because people that are listening in may want to know, and certainly the people that I ask the questions to know more than I do about the subject. And I often lighten up the meetings at my own expense because I have 76 years of material on me. So it's important to keep some levity in all this. It's been a pleasure serving our town, and to those watching, consider volunteering for a board position too. Our town may need you. At that, I open it up.
What are we doing first, clerk or, oh, actually, well,
Chairman.
Chairman. All right, I will nominate Michelle Davis for chair.
Do I have to accept it?
That's the second, Jennifer?
No back, no, no.
All those in favor say aye.
Aye.
Congratulations. Or should I say condolence? No, congratulations. Congratulations. Okay?
So now,
The
as of
clerk.
this meeting, we'll need a new clerk.
Okay.
We need a nomination.
I tell you what, I'll do something that the chairman usually doesn't do for once. And the chairman don't make motions, but I'm going to make a motion that Dr. Patrick Scanlon is our next clerk.
I'll accept.
It hasn't been seconded yet.
Well, I'm accepting so somebody can even accept.
All those in favor say aye. Aye. Congratulations, our
There you go.
condolences to you.
Meeting
Okay.
minutes are approved.
As always.
That's
Next time.
New,
Yep.
new business, new fee schedule. Brian?
Just every year, we vote on a fee schedule for the Board of Health fees for all of our permits that we issue under the Board of Health. There's been a few minor revisions, nothing major. We separated out some of the more expensive fees for smaller permits, such as like residential kitchen and things like that have been reduced because they're not nearly as in-depth or complicated as a full-blown food establishment or supermarket. So these are the fees, pretty straightforward. We will vote on them next meeting to go into effect January 1st, but I gave them to you now so you can review them, and if you have any questions or any ideas, let me know. So that's just for your own information as of now.
Brian, what's the genesis of these permit fees?
What's the what?
The genesis, in other words, you're piggybacking on other towns, or just taking a look at what we have in place and taking into consideration
Me and my counterparts,
inflation, or
me and my counterparts have looked at these fees.
counterparts, meaning in other communities around here?
Correct, yep. And we try to keep them all consistent with the involvement of the permit itself, the involvement of inspections, the complicated and time it takes to work with these establishments for compliance and generate a fee based on that. So inspections, how many are required per year, how in depth are they, how long do they take, just to recoup some of the staff time that we spend doing the administrative part of it and then the field part of it.
And because we're looking at the new proposed fee dated today, is it much difference at all from last year? Pretty much the same. Okay,
Nope,
okay.
not much different at all.
Alcohol state.
Correct. Or town clerk, I think, licensing commission, does the alcohol for the local towns.
Does the seasonal food cover, I know you guys, every year for the farmer's market have been providing an opportunity for them to not pay per market. Is that something that should be thought about for the food?
Each vendor is its own corporation and own company, so they all have their own inspection and they all have their own permit.
But do they have to pay per farmer's market?
No, sorry, it's,
That's what I
each
meant,
vendor
sorry.
pays for the season.
Okay, so they can use the seasonal food establishment.
We have one actually specifically for farmers markets.
Okay. I didn't know if it should be
Yeah.
on the fee schedule, because I think, no?
No,
Okay.
no.
Tony, I didn't see you way back there, and I apologize when I introduced everyone.
Yep.
But this is Tony Wolfen, and she's the department.
She's hiding back there.
Hiding. Okay. So do we need a motion on this? Or is it just for informational purposes?
Informational purposes only, we'll vote at the next meeting, unless you want, you can vote now if you want to, but it doesn't take effect until January 1st.
If there's not much change, might as well.
Okay.
Make a motion to accept the permit fee schedule as outlined here.
Second it.
All in favor, say aye.
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 Accept it.
Tony will revise the header that goes into effect November 3rd, January 1st, 2023.
Communications, announcements, and discussions, COVID-19 update. Brian and then Calvin.
First, we'll start with COVID. Things have been going down ever since our last meeting. They're still kind of hovering around the same area. We still have active cases. I am still monitoring, and Carolyn's still plugging people into Maven every day. So it's there, but it's been very quiet, which is good. I was hoping we didn't see any big uptick after school started. Kids got back into school and being together, playing sports again. That hasn't happened, which is what our main concern was, which is why we were still actively monitoring and doing the spreadsheet every week and getting the numbers out there. So as of right now, the numbers have gone down from last week. We're at about 19 active cases as of this afternoon at 6 o'clock. So still
Say
staying.
19?
Yep, 19 active cases. So far, so good. We're gonna monitor through the holidays as well. But as of now, with the vaccination rates and the availability of the bivalent boosters and the previous boosters and all that, it seems to have really brought things down, and the severity has definitely come down too, which is good. And I will pass it off to Patrick to let us know what he is seeing, if anything.
In the ICUs, minimal
Okay.
that I'm seeing. There are some hospitalizations, but most of the positive tests are just incidental findings still.
Yeah.
And all the patients that I see in the office that are just getting over COVID, it's more either like just stuffy nose or going up to as extreme as just feeling like they have the flu.
Okay.
But I'm not necessarily seeing anything that's like predominantly respiratory.
Good.
Nice.
It's been a quiet fall, which is nice.
You said quiet twice, which is not good.
I'm not superstitious.
Brian, excuse me, Pat, how far away are we from an annual shot?
I actually just saw something today that Pfizer was
So did I, yeah.
doing, gonna start looking into doing flu and COVID at this, in one shot.
They're talking about within a couple of years, I believe.
Yeah, yeah. Actually, just read another article that there now is initial trials going for cancer treatment, for melanoma vaccine using the same technology as the Moderna and Pfizer vaccine to target certain immune cells to attack melanoma. And they picked melanoma. I'm not sure why they based it off of there, but now there's some active trials, and so far looks promising.
I like it.
Yeah.
And then we'll pass it off to Carolyn to talk about our latest flu clinics and potential booster clinics coming up.
We've had, most of our major flu clinics, we're still doing walk-ins, but as of today, we've done 860 flu shots. We had a huge hit at the high school. We do Moderna boosters in the office, but we're gonna have a really big town-wide bivalent COVID booster clinic on November 22nd with Greater Lawrence. They'll have all the bivalents. 5 to 11 bivalent was approved, so they'll probably do that as well as all the ages. So they'll have the Moderna bivalent and the Pfizer bivalent, and we'll do that at the high school later on this month.
Excellent. That's great work. I mean, over 800 flu shots.
Yeah.
That is fantastic.
We're still picking up a few homebounds, but we got huge numbers.
Very successful flu season, and we have the next COVID clinic coming up. So it's out there and available if anybody wanted, but they did just approve the 5 to 11 booster, bivalent booster, which I think some people really will want. So I'm hoping to have a good turnout at the high school. We didn't want to promote that until after the flu clinics were over, because then people show up thinking they're going to get COVID too. So great job. That was fantastic work. And a little breather, right?
Doctor, when the vaccines, the coronavirus vaccines first came out, we had no idea that there would be a second, a third, a fourth, a fifth, and some of us have had, maybe all of us have had 5 shots so far. Is there any thought of a sixth shot? I know they're looking at doing it on an annual basis, but
You just have to think about it as like the flu shot. So why we get the flu shot every year, because these viruses mutate and immunity wanes fairly quickly. So that's why we get our flu shot every year, for waning immunity, but also the variations and the mutations of the influenza virus.
so at this particular time, a sixth shot is not on horizon, other than going forward a year.
But
or
it's
two.
certainly not definitely not out of the realm of possibilities, for sure. Like, and it very well may be that we're just going to be combining flu shots and COVID shots every.
Is
year.
it just right now, Moderna and Pfizer? Is Johnson & Johnson out of the picture
Johnson is
altogether?
Novavax
Novavax
is the other one.
is the other one, but
But yeah, Johnson & Johnson I think is kind of fallen by the wayside.
So if you say get your 4th or 5th shot, can you pick what you want, or is it just what's available?
You can only pick between, if you've got an mRNA, you can only pick between the 2 mRNA.
Ah.
So you can't get the Novavax unless you've never gotten an mRNA before. Your first shot can be the Novavax.
Why would one get that vaccine that doesn't appear to be as effective as the other two?
So if you are hesitant about mRNAs, or if you are unable to get like an mRNA vaccine for some reason, you may choose to get Novavax. But it is not, Novavax does have Novavax boosters, but that's only for Novavax. So you can mix and choose between the 2 mRNAs. So you can get Pfizer and Moderna interchangeably. There's nothing that says you can't. It's personal preference almost. Like, I've always got Pfizer. That's what I choose to stick with, but there's no reason you couldn't get the Moderna.
So it's just a matter of personal preference between the Pfizer and Moderna. Both of them appear to be equally effective.
Yes.
Thank you. Appreciate it.
Did you get your flu shot?
I did, as a matter of fact. I did it online right across the street at CVS, and I had the 5th coronavirus shot there too at the same time. I'm surprised they did it both in the same arm. I thought they'd do one in one arm.
They
the
offered
other.
me to do,
What's that?
they offered me, and I said, please do one
Yeah.
in each, so
Yeah.
you just didn't ask.
Yeah. But it was quite easy to do online, although the formal form is a little bit arduous, but nevertheless, you know, it wasn't that complicated. Just took time to do it, so. Then again, when you get to be 76 years old, everything takes time, so.
Brian, any buzz among your peers with Worcester's indoor mask mandate?
No.
No,
Any buzz up here
I have.
through any of your
I
groups?
saw something in the news about it. So they were thinking about
Into
it,
a
right?
mask. Where?
I thought they did it.
I didn't hear that they actually did it.
I heard they were
They're
thinking
just
about
talking
it.
about it.
Yeah.
I know that it was buzzing, and I was
Yeah.
with, I went to a conference on Tuesday with healthcare executives, and a bunch of people from UMass were getting pulled out left and right for staff, for capacity issues,
Wow.
which didn't seem consistent with
Yeah.
the rest of the state.
Yeah.
So that's why I didn't know if you were hearing anything more.
Wow.
No, I have not. No one's been talking about that at all. I think people are just shying away from that completely.
Yeah,
Interesting.
yeah, I was just
But
curious to,
We
yeah.
have 19 active cases
I
today,
know,
so.
yeah.
Yeah.
Yeah, no, I thought that they were talking about it and then hearing capacity.
I didn't read, like, I heard there was
Yeah.
something about, like,
Yeah.
for other reasons too.
It wasn't COVID specifically, it
No,
was,
'cause
they
RSV
said,
is
they
kind
had
of-
said respiratory I think they said respiratory in general, they were not.
But like, I mean,
Targeting
RSV's
COVID.
around, it's always been around, flu's always been around.
Yeah, no,
I mean, these mitigating factors that we do is just to prevent
yeah.
hospitals from being overloaded. And not really seeing that, so,
Right, so that's
Yeah.
good.
yeah.
Two other quick updates, grants. We have our Public Health Excellence Grant, which has, we just got the contract from the state, signed it. And this is the one referring to regional staff that the state is providing funding for to get some regional inspectors and some regional public health nursing to help backfill some of the backlog of work that's built up over the past couple of years. And we're the host agency for that. So we just got the contract from the state, signed it and sent it back. I'm waiting to receive that back from the state. Working on the intermunicipal agreement between the 5 cities and towns we're working with. It is North Andover, Reading, North Reading, Linfield, and the city of Haverhill have partnered up to get some regional staff. It's $300,000 a year for the next 3 years. So hopefully we get that.
The other point person on that?
Yep. Hopefully we get the check real soon. We're working on job descriptions for the staff we're gonna be hiring, the agreements, and getting the contract finalized and ratified by the state. So
What staff do you envision hiring?
we are gonna be hiring a shared services coordinator, who's also going to be an inspector. We're gonna hire an inspector and a training
Talk about
officer.
for all of these communities.
All of them, yep. So the person will rotate throughout each community and go and help and get list of inspections, or the second position will be a training officer / inspector. So we're gonna be doing some regional trainings. So for professional development and different types of education for us and our staff. And then also, a public health nurse. So to help backfill for clinics, immunizations. If she wants to go on vacation, I'll finally let her.
Do all these other communities, 6 altogether?
Yeah.
Have their own nurse?
Some
That's
do,
regional?
some have part-time. Some have, Linfield
Well, we're
has,
fortunate.
we are very fortunate, yes. So this will be a really good boost to our staffing levels in the region to help this over the next 3 years. And then there could be future grants down the road to help maintain this and sustain it for a longer period. But this is for the next 3 years at least, which is definitely enticing, and they got us to sign up for it and submit applications.
Where does money come from? Is this part of the COVID relief package or package?
This comes from the state through federal
Yeah.
channels, so yeah. But public health took a big hit, a lot of people retired, a lot of people got burnt out. We couldn't keep up with everything going on, so things got put off to the side and on the back burner. And this is one way to help us catch up as a workforce. And likely we have new people coming into the field too, to replace some of the people that have been retired and just got fed up and left. And then the other grant that we have, we are doing the community health assessment. If you guys saw the flyer that went out via the social media channels, Michelle's also on the advisory committee with me. This is a survey sponsored by Andover, North Andover, hiring Health Resources in Action to help us do 2 community health assessments, one for Andover, one for North Andover, to help us game plan and strategically plan our programming for the next 5 years. So the survey is step number 1, and it finally gets sent out this week. I do have the digital copy. I just print these out for you. It's a 15-minute survey. There's also a QR code on this, if you use
This
your
is a
phone.
survey you're talking about online?
Yep.
Yep.
So we'll be getting this out through more channels tomorrow and next week. I'm gonna kind of blast it around town, and if you guys have it and can send it out, that would be great. And hopefully you get a lot of responses, which will help formulate the public's opinion and let us know what the public in general is thinking about health and health disparities and what they want to see moving forward.
Are you gonna, or are they gonna contact the schools to see if the principals will send them out?
I'm gonna contact Cheryl either tomorrow or next week. I think she did get it already, 'cause she's on our advisory committee.
Yeah.
So I was hoping they would have sent it out, but I haven't seen it come through the schools yet. So
haven't seen
I'm
it
gonna
yet.
specifically ask them to send it out to all of their community. So we'll do police, fire, schools, youth center, Merrimack. You can send it to North Andover Moms, have them post it.
I went to go post it on North Andover Moms, and then I went, oh, it was on yesterday.
Oh, it was?
And so I deleted it.
Oh, good, all right.
I did it for my kids' classrooms, but,
Awesome.
yeah, I did 8th grade and, 5th
Yeah,
grade activity.
I want to get out to the sports leagues, youth soccer, youth baseball, youth hockey, youth
Yeah.
football, softball, and then St. Mike's even. You need to send out through their parish. I haven't heard back. I emailed one of my contacts over there twice. Haven't heard back yet. So I'll have to make a phone call.
And did you say there are paper copies or they're not paper?
We're getting paper copies to bring to the senior center. I think that would be a good thing for them to have in person and in hand versus having them do a survey online.
And you have it in Spanish as well? I know when
Yes.
stuff comes to the middle school.
Yep,
Yeah,
it's,
stuff, okay.
it was sent out, there were links for Spanish and Mandarin.
Perfect.
We actually had some respondents in Chinese and Spanish
Nice.
so far, so that's actually pretty good.
Nice. That's wonderful.
Yep. So, any questions on those? Did you ever see the, or go back and review the video?
No, but I
No.
did provide lots of feedback on the survay.
Okay, good.
Which I'm
Right.
sure she loved. I gave tons
Definitely.
of feedback.
Perfect.
Before it went out.
I actually have one question. I don't know if Carolyn, you can help her. If, does the town run any classes for, like, through, I guess, through the senior center for Medicare enrollment?
Yes.
Okay.
They had a rep come in, I'm gonna say sometime last month, to go through all the Medicare stuff. They have like reps that come in to do the new like state IDs and stuff. So they do have reps, but I know there was specifically a rep that did the Medicare stuff.
Thank you.
Concerning seniors, I know that there is information available online, and some of us in the Council on Aging, when I was a member, we had worked on together. There are, I think, about 8 different ways that seniors can reduce their tax base, and there's money out there too. Question is putting it all together, because they're written by state lawyers, which means that no one can understand it. So we try to simplify it, and indeed, it is available on a simple form. You just put some input, some minor questions, and bang, I'll tell you, you may be eligible for this abatement or that abatement, and it's pretty damn good. So I'm quite pleased with that, something that we did for our seniors. So any seniors listening right now, look into it further.
That's all that I have, aside from thanking you for your years of service. You didn't give us enough notice to actually get you anything yet.
Well, he's still here.
Have some hits.
I may never resign, who knows?
Hey, all right.
I just resigned as the board, but the board chairman, but speaking of the chair, our department, our board, our town will be in very, very good hands with you, Michelle. I know it's not gonna be easy, but you're the right person at the time.
It's gonna be easy, it'll be just fine. You've been here long
And
enough.
again, I'll be sitting
You
in the
didn't see the
peanut,
gift I got.
I'll be sitting in the
I gave
peanut
that to
gallery
him.
here with signs and posters like this to help you out. I don't want to give this to you at all, but when I bought it, I said, oh, no, I can't read it. I can't read these words, it's too small text. So this is, by the way, the Robert's Rule of Order, newly revised.
This guy Robert, I don't know.
I think Michelle should read that by next meeting.
I know there's a lot of rules with what you can and cannot post around voting, but is there any way to capitalize on people?
I was gonna ask the town clerk tomorrow.
Oh, okay.
Totally, yeah. If you
I
think
know
of
there's
it,
a lot of rules
Yeah.
on what you can and can't post.
that's not
and promote.
political, it's
It's
just.
not political, but captive audience,
Right?
yeah.
I voted already, so,
Early voting?
yeah.
Nice, good for you.
I did as well.
Nice.
I voted early for many years. The problem is I never signed it, so my ballot is
Null and
inconsequential.
void.
But I signed it this year.
Good job. I don't have anything else, unless you guys have anything else to discuss. All good?
Make a motion to adjourn.
Second.
All in favor, say aye.
All right.
Motion passes.
Right.
The meeting is adjourned. Wow.
All right.